In this video, we will talk about contract research organization with respect to site management organization. According to the definition, CRO, that is contract research organization, means a person that assumes as an independent contractor with the sponsor one or more of the obligations of a sponsor. The CRO is appointed by sponsor as their representative to uphold their obligations in conducting research. They can be outsourced a part or whole of the activities related to the research. For example, designing of protocol, selection or monitoring of investigations, evaluation of reports, preparation of materials to be submitted to the FDA, and so on. A sponsor may transfer any or all of the sponsor's trial-related duties and functions to a CRO, but the ultimate responsibility for the quality and integrity of the trial data always resides with the sponsor. Site management organization is limited to site. By definition, SMO means a person that assumes as an independent contractor with the clinical investigator one or more of the regulatory obligations of a clinical investigator. They may get involved in all of the activities or in certain activity of a research at a clinical research site depending upon their contract with the investigator. For example, preparation and maintenance of case histories, ensuring compliance with IRB review and informed consent requirements, adverse event reporting, etc. A principal investigator may assign trial-related duties and function to a SMO, but the ultimate responsibility for the quality and integrity of the clinical data always resides with the principal investigator. Responsibilities of CROs and SMOs may revolve around setting up the systems and procedures for conduct of the trial and assessment of the clinical data, conduct of the clinical trial in accordance with the applicable regulations and guidelines, communicating the issues to the relevant partners in a timely manner, proper documentation, maintenance of records, and abiding by the contract signed with sponsor or investigator. Contract research organizations can subcontract sponsors' obligations to site management organizations. A CRO may also perform SMO functions. Some CROs can have SMO operations. For example, Austrials, a CRO with SMO operation based in Australia, functions as a leading operator of private clinical trial facilities. Such organizations will collaborate with research organizations and pharmaceutical companies for conduct of the clinical trial. SMOs will have network of sites where clinical trial can take place according to the prescribed guidelines and regulations. If the same company is performing CRO and SMO tasks at the same time, then there should be a clear distinction of roles and responsibilities, and different personnel should be assigned for CRO and SMO roles. If there is no clear description of roles and responsibilities between CRO and SMO, there will be a chances of confusion among personnel for performing certain functions, which further can create misunderstandings at clinical sites also. For instance, role of SMO and CRO personnel regarding the preparation and completion of case report forms. To avoid all these problems, sponsors monitors should clearly understand the difference between the roles of SMOs and CROs. When clinical trials are driven by sponsors, CROs should be contracted by sponsors to perform tasks such as monitoring, data management, analysis, etc. And site management organizations should be assigned by investigators with their tasks such as case report form completion, investigational drug accountability, record management, etc. So to summarize this whole, we can say CRO and SMO both works on the basis of contract. But the main differences are with whom they have contract, what are the services for which contract is done, and their legal liability. Contract research organizations contract with sponsors and are explicitly regulated. On the other hand, site management organizations have contract with clinical investigators and are not explicitly regulated. Contract research organizations are legally liable for the obligations they assume, but site management organizations are not legally liable for the clinical investigators' obligations they assume.